Gentlemen, have you ever been told that if an older man goes too long without ejaculating, he could somehow be putting his health in danger? It's one of those claims that gets repeated between friends and across the internet until it begins to sound like established medical fact. But the reality is more complicated. Many men over 60 naturally experience changes in sexual desire. Some are single or widowed. Others may be dealing with erectile difficulties, medications, health conditions, or simply less interest in sexual activity than they had years ago. Then comes the worry. Should I be forcing myself to ejaculate regularly to protect my prostate or maintain testosterone? I'm Dr. Leah, and today I want to separate what we actually know from the myths surrounding ejaculation after 60. More importantly, we'll discuss the health signals that deserve far more attention than counting how many times you ejaculate each month. Before we begin, like this video, subscribe to the channel, and tell me in the comments, what's the biggest men's health myth you've heard about aging? Now let's address the first misconception. Your reproductive system isn't a pressure tank that becomes dangerously full when you don't ejaculate. Sperm continue to be produced, but unused sperm don't simply accumulate indefinitely. Your body naturally breaks them down and reabsorbs their components. So going weeks or even months without ejaculation doesn't automatically create a dangerous buildup or mean you're damaging your body. And that immediately raises the next question. What about your prostate? Now let's talk about the prostate, because this is where much of the confusion begins. You may have heard that going too long without ejaculation causes prostate fluid to build up, creating inflammation or even disease. That sounds believable, but the evidence doesn't support such a simple conclusion. Some long-term research has found that men who report more frequent ejaculation also appear to have a somewhat lower risk of developing prostate cancer. That's certainly interesting, but there's an important distinction every man should understand. Association does not automatically mean causation. Researchers cannot simply conclude that ejaculation itself produced the lower risk. Men who remain sexually active may differ in many other ways. They might exercise more, sleep better, have fewer chronic illnesses, manage stress differently, or maintain healthier lifestyles overall. So, should you avoid ejaculation? Generally, if masturbation or intimacy happens naturally, feels comfortable, and fits your personal circumstances, there's no reason to fear it. But should you force yourself to ejaculate because you're afraid your prostate will suffer if you don't? The evidence doesn't establish a required number of ejaculations that every man over 60 must achieve. And this is where many older men become distracted. They start counting days and worrying about frequency while overlooking health changes that may be far more important, because sometimes a change in sexual function isn't caused by how often you're ejaculating at all. Sometimes it's your body's early warning about something deeper. And one of the biggest issues hiding behind those changes is poor circulation. Now let's talk about circulation, because this is one area men over 60 should pay close attention to. Many people associate poor blood flow only with heart disease or high blood pressure, but circulation also plays an important role in sexual function, energy, healing, and overall health. The blood vessels supplying the penis are relatively small. Because of that, changes in erectile function can sometimes appear alongside underlying vascular problems. A man may assume weaker or less consistent erections are simply the unavoidable result of aging, when other health factors could also be contributing. Conditions such as diabetes, high cholesterol, obesity, smoking, and poorly controlled blood pressure can gradually affect blood vessels and reduce healthy circulation. Think about a garden hose that slowly becomes narrower inside. Water may continue flowing, but not with the same strength it once had. Something similar can happen when blood vessels become less healthy over time. That's why worrying constantly about how many times you ejaculate each month can distract you from a much bigger issue. Instead, pay attention to the habits that support your cardiovascular health. Regular walking, strength training, nutritious foods, healthy fats, blood sugar management, and adequate sleep can all contribute to better overall vascular health. And what supports your heart often supports your sexual function as well. But circulation isn't the only subject surrounded by myths. There's another question older men repeatedly ask. Does ejaculating frequently lower testosterone, or can avoiding ejaculation actually increase it? Now let's address testosterone, because this is another area where misinformation spreads quickly. Some men believe that avoiding ejaculation allows testosterone to build higher and higher. Others believe the opposite, that frequent ejaculation drains testosterone from the body and eventually leaves a man weak. Neither idea reflects what the source explains. Testosterone naturally fluctuates throughout the day, and levels can gradually change as men grow older. But ejaculation frequency alone isn't presented as the major factor controlling those levels. Other parts of your health can matter much more. Think about poor sleep, excess body fat, chronic stress, heavy alcohol use, certain medications, and untreated medical conditions. These are the kinds of factors that deserve attention when you're concerned about hormonal health. If you're experiencing unusual fatigue, a substantial reduction in sexual desire, declining muscle strength, or noticeable mood changes, don't automatically blame how often you ejaculate. Speak with your healthcare provider. An appropriate evaluation can help determine whether testosterone or another underlying health issue could be contributing to those changes. Most importantly, don't force yourself into a sexual schedule because someone online told you every older man needs to ejaculate a specific number of times each week. There is no one-size-fits-all calendar. Some healthy men over 60 remain very sexually active. Others ejaculate much less frequently and can still be healthy. Your individual health, comfort, circumstances, and desire matter far more than trying to reach an arbitrary number. Now let's talk about stress and anxiety, because sometimes worrying about ejaculation can create more problems than ejaculation frequency itself. When a man becomes convinced that he must release a certain number of times each week to remain healthy, intimacy can quickly turn from something natural into another source of pressure. You start counting days. You wonder whether you're doing enough. Maybe you become concerned that lower desire means something is wrong with you. That constant worry can affect the very sexual function you're trying to protect. Stress can interfere with sleep, sexual desire, erections, mood, and relationships. Instead of allowing your body to respond naturally, you may find yourself constantly evaluating your performance. That's why I encourage older men to stop focusing on arbitrary numbers and start asking more meaningful questions. Are you physically active? Are you sleeping properly? Are conditions such as diabetes, high blood pressure, or high cholesterol being managed? Have you noticed changes since starting a medication? Are you keeping up with regular medical appointments? Those questions tell us much more about your overall health than simply asking when you last ejaculated. Your body doesn't need you to follow someone else's sexual schedule. But there is one question every older man should ask. Has something noticeably changed? A gradual change over many years may accompany aging, but a sudden or significant change in sexual function deserves attention. So, what kinds of changes should actually get your attention? One of the most important things you can do after 60 is learn the difference between a gradual change and a symptom that deserves medical evaluation. If you develop persistent erectile difficulties, especially when the change feels sudden or noticeably different from your usual pattern, don't automatically blame age or ejaculation frequency. Sexual function can sometimes reflect changes involving circulation, hormones, nerves, medications, or other aspects of your health. The same applies to pain during ejaculation. Sexual release shouldn't repeatedly hurt. And if you notice blood in your semen, persistent pelvic pain, difficulty urinating, or a dramatic unexplained reduction in sexual desire, don't simply wait and hope everything disappears. These symptoms don't automatically mean something serious is wrong, but they deserve a conversation with your healthcare provider. One of the biggest mistakes older men make is delaying that conversation because they feel embarrassed. Some tolerate symptoms for months because discussing erections, ejaculation, or prostate concerns feels uncomfortable. But your doctor has heard these questions before. Speaking openly about sexual health can help identify whether you're dealing with a prostate problem, medication side effect, hormonal issue, vascular condition, or something else that may be manageable. So instead of asking only, "How often should I ejaculate?" start asking, "Has my body changed in a way I need to investigate?" That question can tell you far more about your health.